Okay, can I have the residents come up front and take their seats? Dot. Can I please have the residents come up front that are graduating and take their seats?
My turn. All right, let's get seated. Well, all right, we're just about to start. Please take your seats. All right, good evening. I'm going to bring some attention to this party. Good evening. It is what it is. We're getting there. Good evening. This is the part where you say good evening. There. Nicely done. We ready? Perfect. There's little people helping me. It's amazing. Good evening. Welcome to the 2022 ArnotHealth Graduate Medical Education Graduation Ceremony. I'm very glad you're here. My name is Mike Witt. I'm the designated institutional official, which basically means that I direct and maintain all of these programs on the good days, the bad days, and everything in between. Why do we have GME programs here? We have them simply to produce great physicians, and that's case examples, okay? After we attain that goal, our next goal is to produce great physicians that we retain here. There's nothing better than watching these guys grow up, become amazing docs, and then getting to keep them on as faculty. And the cycle continues. These have been, to say the least, unprecedented times. Most of our graduates in front of you have spent more than half of their training under the umbrella of the pandemic. And it's changed their experience, and it's produced the stories that they're going to have for the rest of their careers. And that's a tough thing. It's a tough thing to swallow. On the other hand, it's an amazing experience, and I'm glad they've had it here with us. So, of course, I'm asked for my opinions about, where the country is going, where medicine's going, and then people pretty quickly realize that I don't have the answer. Okay? There's a pandemic that's killed more than 1 million Americans, and perceptions that our rights come before public health or the safety of others. This is a country where the distance between the haves and have-nots have worsened. We can provide the best health care in the world, but there's lots of places where we don't. And we certainly don't deliver it to everyone. Addiction issues, psychiatric care issues, elderly care are under-resourced and underappreciated, and our patients are often left suffering. Clearly, I don't have the answers. I wish I did. If I did, I'd tell them right now, we'd write them down. But I don't. But what I do know is that our role at Arnott is to produce great physicians who can work in this environment, succeed, and help take care of our fellow Americans. To the families and loved ones of our graduates, maybe you guys know what your graduates are doing, maybe you don't. I see them work every day. I've seen your graduate cut somebody open. I've seen your graduate put breathing tubes in people. I've seen your graduate tell patients that they have cancer. I've seen your graduate tell people that their loved ones have passed. I've seen their graduates hold hands with patients and give them the worst news ever. And I've seen them hold hands with patients and give them the best news ever. Okay? If you're a family member or a loved one and you're not in the field, it's hard to imagine your children, spouse, whatever, in this sort of scenario, but they're amazing at it, and they're amazing because of their devotion, and they're amazing because of the training and the experience they've had here at Arnott. I bet you can see the development and maturation they've had over their time, and I bet that your family members, your graduates, are developing into the kind of physicians that you wish that you had as a patient. I thank the families who have supported their loved ones through this long journey, 3, 4, 5, 6 years, never mind everything that came before. And I think that you guys have been on the path with them just as much. So how about a little applause for the families? Thank you. A couple more thank yous, if I may. We owe a special thank you to our residency coordinators. Most of them are sitting over here. Paula, Angela, Lindsay, Allison, Sandy, Melissa, and Kathy. We thank the administration of ArnotHealth for their ongoing support and are thankful for the partnership that we have created to take care of our community. In particular, I'll point out Mr. Lawrence, Dr. Hennigan over there. You can stand up, Steve. Thank you. Thank you to our program directors and faculty, and thank those members for being here tonight. Dr. Baxter said this is, the best day of the academic year, and I agree. But every day is a good day. Without you guys and ladies, none of us could be here celebrating the maturation of these graduates as we go through this long road. Believe me when I say this, that I can't do this alone, and you don't want me doing surgery. So, thank you, faculty and program directors. And lastly, I thank you all for being here and celebrating and supporting our graduates. Again, it's been a long road. They're exhausted. Look at them. They're all shiny right now, but they're tired. It's exhausting. They're going to be amazing doctors. I'm very proud of you guys. I've been here your whole road, not in this role, but I've been here your whole road, and you're unbelievable. So thank you. Congratulations. Thank you for being here for me, and I'm glad I could be here for you. All right. I'd like to introduce Dr. Richard Terry.
Good evening. This is one of my favorite times of years. We graduate another group of residents. It's the end of a continuum of training for these residents that began really a decade ago in college as pre-med, then the rigor of medical school and residency. So many of these grads tonight were actually students here that we trained, some of them here as the early beginnings of our nascent graduate medical education program in 2014, where we graduated just 2 residents. And tonight, 36. Unfathomable. Among them, Mike Kojak, our resident, our GI fellow, several of our family medicine residents, Lauren, Mike Angelino, Lauren Yee, Jeannie Bajus from Psych, Brittany from IM, and of course, Joe Berkman from Radiology has been here for years. Many did their core rotations. We're going to name the place after him, but Joe's favorite spot used to be the diner before COVID. Mine too. They did many of their core rotations and their 4th-year electives here, but they've completed this continuum of education. We're also proud of you, of your training and growth at Arnott. On one hand, it's this wonderful experience to witness the maturity of these students to residents and to attendings, many who will practice here. On the other hand, it does make me reflect back and say, boy, I'm getting old, as my daughter who's 11 reminds me often. But graduates, sooner or later, you got to realize one thing. It all comes down to your mindset. When you focus on things that you can control, there is always an action you can take to put yourself in a better position. When you focus on things you can't control, you freeze, unsure of what to do, and you wait. This is no time to wait in medicine, as recent events have shown us all. As Dr. Wade alluded to, you sure have trained in unprecedented times. This pandemic has caused so much pain for families and such disruption to every healthcare system in the United States. But alternatively, what you've witnessed is this most incredible advancement of medicine that I've certainly ever seen in my career, with an effective vaccine less than a year, an antiviral therapy with a 90% efficacy in reducing death and hospitalization. That's remarkable, that medical innovation that's been accomplished in this country. But in that, we've lost something here, folks. We've lost something. And it's that personal interaction with patients, those relationships that we build with patients, those interpersonal skills that you've been taught by your very wise faculty here and program directors, all whom I know well, all who are practicing physicians. And they've taught you that critical element of humanism in medicine. Unfortunately, COVID has so disrupted that continuum of care for our patients in both the inpatient and outpatient setting. And you know, we want to say telemedicine. Telemedicine doesn't cut it completely when your doctor's off completely somewhere. It doesn't replace it at all. And the end result is that it can move us further from our patients. So I urge all of the graduates, as you enter practice in whatever specialty, to get closer to your patients, because it is that relationship that is sacrosanct. That bond between physician and patient, that trust enables us to be a healer, enables us to heal them. So, I want to read a passage from a poem that I came across, which have some faith in. It'll all come together in the end. It's called Several Days Before Christmas. It was a little near noon when the drizzle began. A truck skidded sideways on a bridge and overturned. The driver wasn't hurt, but underneath his truck lay a car. Roof caved in, driver's head crushed. Before setting out, she had firmly buckled her 2 young sons in the back seat. In the hospital, I examined them. Some scratches from a window glass turned sharp now. They don't ask about their mother, who'd gone straight to the morgue. Her husband at work was only told there'd been a wreck. His wife was hurt. When he arrives, a silent nurse leads him to that room we keep for such occasions. How do you do that? How do you do that? Introduce yourselves, not by your first name. Use the title doctor. It's pragmatically superfluous now. The little good you did. This is for shamans. Start easy. Your sons are fine. They're not hurt. But I don't have good news about your loved one. Then shut your mouth for about 10 seconds. Sit and lean forward. Take their hand and allow them to poise in their grief to ripen. And don't proceed. I repeat, do not continue until you feel their pain yourself. Only then give the truth. Don't be afraid. And use that word death as the floor caves in and sinks with them. That poem is from a book, The Problem with Zero, written by perhaps one of the most humanistic physicians I've ever met, Dr. Frank Edwards. Because we're going to recognize his retirement as well. The words in Dr. Edwards' poem speaks far more eloquently than anything I can say. In fact, just about anything Frank says or writes is far more eloquent than anything I can say. But be the physician we've trained you to be. The message is feel your patient's pain. Feel their joy. And you're going to find that as therapeutic as any procedure, any prescription, or anything that you can do. So congratulations to our wonderful graduates. You are fantastic and will make a difference. No, thank you. No. All right. I told you it'd come together. Now I want to talk a little bit more about Dr. Edwards, if I may. So I had the pleasure of meeting him around 2013 or so. He'd worked for a guy named Dr. J. Ellie at that time. They had a hospitalist group and an EM group. and Frank was the medical director. Frank hadn't been involved in academics in much of a formal way for a lot of his career, but in 2013, we had this auspicious idea, gosh, we need an ER residency here. It was a dream. Times were tough. We had mostly locums, that's temporary doctors in our ER, and it was hard to recruit people, real hard. Yet we were trying to start an ER residency. We'd gone through a couple attempts, had a couple folks that we thought could lead it, but we didn't have anyone. No one that could believe it would be possible that ArnotHealth could or should have an emergency residency, till I met Dr. Edwards. He had the vision. You see, Frank had worked in small ERs all his life, and he saw what the lack of board-certified ER doctors, what it meant. He was the driving force that put this program for ER together. The entire curriculum, which is the foundation of the program, the Friday academics, all of these incredible collaborative agreements, this was all Frank's vision. In fact, the emergency medicine program was our first program to achieve ACGME accreditation, thanks to Frank. That incredibly rigorous, onerous process. Now I can say, ArnotHealth is the largest producer of emergency medicine physicians for the Southern Tier, as many of our graduates work here at Arnott, at Guthrie, and UHS, all because of this program. This truly remarkable, top-notch emergency residency program here in Elmira, thanks to the efforts and perseverance of Dr. Frank Edwards. In 2018, Frank took over as DIO at Arnott and continued his leadership in getting our other programs through this process of ACGME accreditation. He then developed an entire research curriculum, research fellowships, and an institute of research, which each year continues to get more robust. Dr. Edwards, as you now know, he's a scholar, he's a poet, he's a writer. You can Google him. He's written many books, an outstanding writer, many peer-reviewed articles as well. But mostly, and tying into graduation, is he a humanitarian and a role model for every graduate and for all of us. Frank, in closing, I'm just going to quote another poem from that book, The Problem with Zero, titled Future Historians. Every time I hear that pompous phrase, when future historians analyze these times, I feel a quiver of disgust. What's the chance these wise machines will give a tinker's damn about the likes of us? Well, Frank, I can tell you, you have made an incredible impact on medical education that will be analyzed by future historians, and they will say, transformative, a remarkable physician, a remarkable person that you are, and your efforts, your contributions will not be forgotten. We're gracious for your contributions, for the difference you've made in every medical student, every resident that you've come in contact with, and in recognition of that, we'd like to present you with a gift of our appreciation. So thank you very much, Dr. Edwards. So, come on up. And I'm going to let you give that.
I'll just read the inscription real quick. Says, Dr. Frank Edwards, pioneer, mentor, friend. Thank you. I have the box over here, but...
So congrats, Dr. Edwards, and congratulations to all our graduates. Godspeed to all of you. Thank you.
Well, clearly Dr. Terry has a few more of the answers than I do, so that's embarrassing. No, I'm just kidding. So next we're going to have Mr. Lawrence. I hope I'm not setting him up to have even more answers, but Mr. Jonathan Lawrence.
Thank you, and good evening. I knew I'd be following Dr. Terry this evening, but I didn't know I'd be following the writing of Dr. Edwards, otherwise I would have politely declined. On behalf of the Board of Directors, our executive team, and the entire ArnotHealth organization, it's my distinct privilege and sincere pleasure to welcome you to this evening's ceremonies. Once again, this year, given the continuing challenges presented by the COVID pandemic, we are fortunate and grateful to be able to celebrate the accomplishments of our graduates live and in person. After yet another year of masking, social distancing, seemingly endless video conferencing, I think we have all come to cherish the value of being in the company of colleagues, friends, and family whenever the opportunity presents itself. It's an unfortunate reality that most of my 4-year tenure as CEO at Arnot, and for many of our residents, their tenure, has necessarily been focused on successfully navigating our way through the pandemic. I won't spend time itemizing the numerous challenges. We've talked about them. These are well known to many of us here today, but suffice it to say that the financial and operational impact and on our organization and healthcare delivery across the United States and our country has been profound. The consequences will leave a lasting impact on the complexion of the healthcare landscape and our institution in ways that will prove to be both detrimental and beneficial to accessibility, cost, quality, and the delivery of care. As the largest New York State-based provider of care in the region, Arnot has led the effort to protect and care for our community, as demonstrated by the tens of thousands of vaccinations and tests that we have administered, the establishment of a COVID call center, our mobile pop-up vaccine clinics, specialized respiratory clinics, among numerous other efforts. We can take pride in the way that ArnotHealth has not only demonstrated our operational effectiveness, but the way we have continued to cultivate a strategic, future-oriented posture that has fostered significant continued investment in our people, our technology, and our facilities. This has been largely inspired by and is intended to directly benefit our residents and the continued development and improvement of our graduate medical education initiatives. For example, during this period, we have completed a multi-million-dollar renovation and expansion of the Arnot Ogden Emergency Department. Among the many benefits, we feel this project is especially important given the significance of our emergency medicine residency and the desire to continue to attract and retain the very best EM residents, faculty, and staff. And as an aside, let me just say for any residents that are considering going into healthcare administration and have those ambitions, I do not recommend doing an ED expansion during a global pandemic. Additionally, in the last 2 years, we have invested millions more to upgrade and replace our magnetic resonance imaging and CT equipment. This is not only to benefit our patients, but it is very much meant to ensure that our radiology residents have access to state-of-the-art technology that they need to cultivate their skills to the fullest potential. This year, we have also invested in the Da Vinci Xi, introducing state-of-the-art robotic surgery to Arnot for the first time. Since we do not get paid more for doing robotic procedures, this is a substantive financial commitment which demonstrates our commitment to attract the most talented surgical staff and to develop the best trained surgical residents. While the pandemic, supply chain issues, microchip shortages, and other challenges have delayed our efforts, Arnot is continuing to advance to acquire and implement Epic, a unified, state-of-the-art electronic health record platform that is increasingly becoming the standard of care for organizations of our size and profile. Once the Epic transition is complete, it will have nothing less than a transformational impact, replacing numerous other applications and processes. Epic will not only enhance our delivery of care and service to our patients, but also our ability to attract, retain, and train our residents with state-of-the-art information technology and processes that will further ensure they are well prepared wherever their career may lead them. And for those of you who work with our eClinical work system, the urgency of this initiative is painfully obvious this month as we continue to address issues with that application. In addition to investing hundreds of thousands to improve resident compensation, this year we have also committed to expanding our complement of research associates. These associates will provide vital support to our residents and medical staff, and their contributions were quite evident during the recent annual Daniel Manganaro Memorial Scientific Symposium, where there were a record number of outstanding submissions. From my perspective, the quality of this work was unprecedented, demonstrating not only intellectual rigor, but practical applications to improve both clinical outcomes and the patient experience, something that's truly fitting tribute to the memory of Dan Manganaro. As our graduates, we share in your successes and accomplishments. Your professional growth and development is a source of continuing inspiration and innovation, motivating us to continually invest in the quality of our programs, our facilities, and our services. We are deeply grateful for your service to our institutions and the community we serve. Many of you may soon leave Arnott, but we hope and expect that Arnott will not soon leave you. You will always find an open door here and a warm welcome. You have our profound gratitude, our hearty congratulations, and our sincere best wishes for your continued success and a lifetime of professional satisfaction and personal fulfillment. Thank you.
Thank you, Mr. Lawrence. Let's get on to the ceremony. Dr. Buffo. Moving out.
It's like Christmas. In an early memo a couple months ago, the GME office questioned us as whether or not we give gifts to the graduates, and we do. Our job as educators is to create independent, competent, compassionate doctors, echoing what has already been said before me. Competence in radiology has cognitive and technical components, which is why training is 6 years postgraduate now for our residents. The most interesting thing, most gratifying thing I find about observing our residents' maturation is that they each reach that level at different times. At some point in their training, you see the light go on. And they suddenly realize that they've gone from trainee to trainer. The student becomes the teacher. That happened to Joe about a year ago. His cognitive skills were ahead of the mean, and like many of my colleagues have admitted, beyond in some cases. I have to admit, and I think Ed Acosta said it this morning, that there are times where Joe will come in, we'll review a case, he'll say something about a disease that 39 years ago I probably knew something about, and I kind of just nod my head and say, I got to run to the bathroom. And I go, Siri, what the heck is? And I'm starting to think that my residents think I need to see a urologist, because that's more and more often happening. I've been wondering, but they asked the question, what has Joe done with the time, since his coming to attending status? And he's honed his skills. He got married to our lovely Samayo, who's somewhere. He's prepared to move to Florida, and, oh yes, study for his oral boards, which are at the crack of dawn on Sunday morning, short 48 hours from now. I have learned many things from Dr. Berkman, many things. But the most important, the most valuable is how to make the finest Manhattan. It's all in the bourbon, really. Basil Hayden's what we use usually, and in the proper cherries, Luxardo. Artful and Arnott send you off to fellowship at USF in Tampa. Our door is always open. Always love to see you back. We send you with a first aid kit to subvert your first year. A box of Padron 1926 Anniversary Series with a waterproof cigarette lighter because it's damp and wet in Florida, we figured. And the ingredients for an emergency Manhattan. So Dr. Emily Ray has many, many great strengths, but one weakness. You know, we all have our shortcomings, and chocolate milk is not a horrible one, but I only hope that in Syracuse they have a 12-step program for chocolate milkaholics. But given that her strengths are so obvious, when she and Johnny came over to visit us at the farm, she not only enjoyed, the farm and seeing all our fowl, she had her boots on and kind of engaged herself with the ducks and the chickens. Much to what I didn't know was that she has this ornithology, need, and she's a bird lover. She got in the mud with the pecans, the cayugas, and all sort of others. And so one of the things that we want to give her is a send-off with some bird paraphernalia. One of her other accolades is that she was the champion in our effort to get ACGME accreditation for our ESIR program, which is Early Specialization in Interventional Radiology, which we received after appeal this year. So she deserves an accolade for that. Her research prowess is now legendary. I think that she publishes and has more research going on than anyone else. And she may have that distinction for years. I'm on the wrong page. Maybe I need to go to the men's room and ask Siri something. Case reports, poster presentations, quality projects, all sorts of coordinations, independent leader. She interacts with faculties in multiple departments, cross-covering all other things. Syracuse will no doubt gain a great researcher as she pursues her interventional radiology fellowship next year. So Artful and Arnott send you off with a host of bird paraphernalia, your chocolate milk, and our best wishes.
Congratulations. Next, Dr. Kellogg, please.
I have only been their program director for 1/6 of their residency, so I think that it is only fitting to invite Dr. Bohan up here as well, wherever he is. I certainly want to echo what my colleagues have said about this being the happiest day of the academic year, but at the same time, it's also the saddest day of the academic year. You know, we spent 3 years of 80-hour weeks getting these people right where we want them, and now they leave us. So it is, you know, both with great happiness and with great sadness that we're up here tonight recognizing them. I think this class really taught me more than I taught them in the 3 years they've been here. I've learned so much working with each and every one of you. Truly a talented group of leaders who are going to go far in the field of emergency medicine. I wouldn't be surprised if all 6 of you wind up program directors or CMOs in a few years. As Dr. Witt was saying, COVID really hit this group hard, and I know each and every one of you professionally struggled every day dealing with being on the front lines of the pandemic. So, you know, really a Herculean effort by all of you. To recognize you each individually, Dr. Britton, as I said this morning in the award ceremony, Dr. Britton truly embraces the educator scholar role in his embrace of ultrasound, in his centralizing ultrasound to our practice in our department. But, you know, if I had to think about how to summarize Taylor, he is laid back intensity. You never think that he's gonna just show up and have the most A game there is, but sure enough, he does each and every time. I also have to thank him for upping my coffee game in a very dramatic way. I had a Mr. Coffee before I met Taylor, and I've really improved from there. And the other thing that probably nobody in this room knows is that he built a climbing wall in his apartment. And one of the greatest things early in the pandemic was seeing it anytime I Zoomed with him. Taylor, you are going to be a great success as an emergency ultrasonographer, and I wish you the best of luck. Oh, my note's locked out there. Dr. Doc Wallace, hiding back there, hey. More than I think anybody else, you have pushed me to be better. I don't want to say that you complain, but you advocate very well. You have pushed me to be a better physician with evidence-based medicine. You have pushed me to be a better educator by always questioning, always asking for what's best for the patients and for the residents, and certainly with making sure that you guys are taken care of and getting the best that you can from this institution every day. On top of that, though, there are a few people that I know who, when push comes to shove, just put their shoulder into it and go. And Dr. Dakwale, you are an incredibly strong physician. I know that you will be a great success wherever you go, and I think you are going to wind up an administrator one day. Congratulations, sir. Our next graduate is Dr. Fields. Dr. Fields is one of those residents who came into the program knowing what he wanted to do. He wanted to be an EMS physician, and that is indeed what he is going to do. Dr. Fields has one of the strongest moral compasses I've seen in a physician. He consistently advocates for what is best and what is right, and I think pushes all of us to truly be the best physicians that we can be, doing the best for every patient that we see. He's also a very evidence-based physician, and I think as Dr. Buffo was saying, he's somebody who prompts me to look things up anytime he's not looking, because he is always going to be quoting to me the latest article on COVID, the most up-to-date evidence on whatever it is. And I guess the other thing is, as a future EMS physician, he has not only been a leader in our department, but he has really taken a leadership role within our EMS community and enhanced the care of patients across the southern tier. So thank you, Dr. Fields, and congratulations. Next is Dr. Hall. My first memory of Dr. Hall is when Dr. Edwards said, "Hey, we have a pro baseball player that wants to come do residency." And I said, well, he's going to have an attitude. Dr. Hall has a wonderful attitude. He is a joy to work with. He is the critical care guru. If you have a sick patient, you hope that Dr. Hall is the one who's on with you that day. He has been a joy to work with. He has done phenomenal things teaching our medical students, and I think really enhanced their experience in the ER. I am so thankful that you are going into academia because you have to teach, Bill. You're going to be great. Congratulations. Only two left. Dr. Skiffey. I think if you asked any of the faculty to describe Dr. Skiffey, they would say that she is a rock-solid physician. She is somebody who I have never had a bad shift with. She is always there, ready to work, smiling, engaged, gets the work done no matter what. Provides excellent patient care. She's a leader amongst our residency, a leader to the staff in the department. If I had to have one criticism of Dr. Skiffey, it's that I think I've put on 15 pounds since she's been here because of all the baked goods she brings to the department each and every shift. Dr. Skiffey, I will miss you. My personal trainer will not. Congratulations. Whoa. If you fall coming up, you don't get to graduate. We get to keep you. And last but not least is Dr. Zagmoot. I think Dr. Zagmoot is one of those residents that we will be talking about for years to come. He is a defining sort of resident. He has really left his mark on this program for the better in ways both large and small. The fact that we have a pediatric ICU rotation for our residency going forward is thanks to his efforts, his advocacy, and his willingness to be a trial balloon. As I talked about this morning, he's taken our nascent idea to have a blog and turned it into a scholarly repository for all of our residents. He is somebody who all the juniors look up to, and one of my proudest moments as an educator was watching Dr. Zagmoot coach one of our interns through running a code. I was happy because I got to sit in the back of the room and do nothing, but truly watching somebody that I had taught be able to run the room while teaching somebody else made me prouder than I can ever express. So, Dr. Zagmoot, congratulations. Dr. Bohan, do you want to say anything?
Boy, I think you said it really well. This class, I think, watched them all through the years, and really have watched them grow. And you know, listening to Dr. Kellogg speak, like, he really kind of nailed it on head. It's like he was reading my mind. They are a class full of leaders. Like, they're not going to be just ER docs. They're going to be leaders in their departments. They're going to be leaders in their hospitals, each and every one of them. It's a very special group, and I'm so proud of all of them.
Congratulations, and thank you, Dr. Kellogg, for the repurposing of advocacy. Sometimes in my job, there's a little more advocating than other days. All right, Dr. Baxter.
Sorry, it ain't cigars. I want to know what I have to do to get a Padron 1926. They're my faves. So, 5 years of training. I'll pass. Well, this really is my favorite day of the academic year. It's always fun to watch people come in as raw interns and leave as seasoned physicians. I know that being a program director is sometimes being like a parent. You're not supposed to have favorites, but too bad. This group is one of my favorite groups. They've just been, quite frankly, a hell of a lot of fun over the past 3 years. And at the risk of beating the P word, pandemic, to death, this group responded amazingly to that pandemic. The continuity loss was very minimal. They kept the clinic running. They went out to the walk-in clinics, and they really just kept getting after it and volunteered to do extra work. They had each other's backs. That may be, to me, one of the defining characteristics of this group. They really looked out for each other, and it was really, it's just cool to see. So, for the gifts, we will be giving them our traditional Dr. Seuss, all the places you'll go, along with these nice little scrolls that are empty, like my soul. So first, Ben Allison. Ben was one of our chiefs this year, and he was also one of our rural track rock stars. And yeah, let's hear for the rural track. And one of the things that impresses me the most about Ben is his quiet intensity, and intensity isn't meant in a bad way. I mean, he is very even-keeled. At least I've never seen you really annoyed. Like, if I'm annoyed, you have to be concussed or unconscious to not notice. But if he was, I never really picked up on it. He's been functioning in an attending level for probably 6 months at least now, and he's going to go out and do great things. Unfortunately, we don't know where yet because he doesn't have any dry ink that I'm aware of. Okay. But whoever lands you will definitely be getting a great family doc. So, congratulations. Okay, next is Michael Angelino, our other chief. There is one word that I could use to describe Michael. It is innovative. He and Ben were an amazing team of chiefs this year. He came up with more ideas on how to improve the education, the didactics, just the little things that he introduced in the clinic, as well as didactics. He's also been achieving at an attending level for quite some time. He's going off to sunny Florida. He's already got his crib where I plan to crash when I come and visit and do reconnaissance on retirement homes. But he's been a real pleasure, and best of luck and congratulations. Next, Sonny Amram. If I could come up with one word to describe Sonny, it would probably be irreverent. Again, not a negative thing. It's just more polite than smartass. But Sonny is the winner of the Joseph Matthey Extra Effort Award this year, if you were at the award ceremony, because he's somebody who really, genuinely, once he found his path through his education, embraced it and just exploded with his knowledge and his wisdom, and there is a difference. You know, tomatoes and avocados are fruits. That's knowledge. Wisdom is knowing not to put them in a fruit salad. He knows how to apply what he's learned, and he's probably also most likely to encounter HR at some point if he doesn't get a filter. But it says to be determined here. I know he's going to be in sunny Florida, so when Mike doesn't have room for me at his crib, I expect to crash at yours. So congratulations. Okay, next. Marta Hernandez Herman. Marta is one of the, well, let's put it this way. This class has two of the kindest, sweetest human beings I've ever met, and Marta is one of them. And if I could just have one word to describe her, it is pleasant. She's always smiling. She's a native Spanish speaker. I've been trying to teach myself Spanish with the Duolingo app, and I suck at it. She's always giving me encouragement, always telling me I'm doing okay, even though I really know I'm not. And we're fortunate that Marta's staying here for Arnott. And I know her patients love her. She's just that sweet, that nice. If you don't like her, there's a hole in your soul somewhere. So congratulations, Marta. And thank you for baby Henry's presence on didactics. She has the most adorable little dude, and he's been on didactics quite a bit, and we love him. Okay. Next is the second of the two nicest, sweetest human beings I've ever met, Sahar Kareem, the winner of the inaugural Program Directors Award, given to somebody who exemplifies the best qualities of compassion, collegiality, and competence, and kind of does it under the radar. And if I could think of one word to describe Sahar, it would be thoughtful. It comes through in her plans, it comes through in the way she deals with patients. When she would precept cases with me, I would just be like, dang, I could really learn a lot if I just shut up and listen to her. So she is looking in Long Island, New York area for a job. I've been doing my best to try and, make her sound not so good, hoping that, because if it ain't dry ink, I'm hoping you'll stay here. But she's going to be amazing for her patients as well. And it's been a real pleasure watching her develop as a resident. So, congratulations, Sahar. Okay, last one of the people who are present. So I do need to talk about a couple who aren't here. Jeff Collins isn't here because he's got dad duty, and that's too bad. He should have brought her. She was a regular presence on didactics too. Just the cutest little massive blonde curls you ever saw. Personality plus. Jeff will be staying with us as well. He will be working for Arnott. I believe, in Big Flats with Dr. Westervelt. And I know that he's also got designs on GME eventually. So who knows? Maybe one of these days after I ride off into the sunset, he'll be up here. Also not here is Sean Neely, MD. Sean graduated this past January. He elected to not be at last year's ceremony because he was afraid it would jinx him, but then ended up not making it to this one. Sean came to us from urology. He actually got 80% through a urology residency. That's 4 years, folks, and then decided, I think I'd rather do family medicine. Urology's loss was definitely our gain, and he's now up in Rochester, working for Rochester Regional, and I kind of wish he was here because I miss the guy. So, okay, back on task. Last but not least, Lauren Yee, the Hawaii native who's in the Army. I've not encountered a lot of flower children who could kill me. The cognitive dissonance is kind of troubling at times. But if I had one word to describe Lauren, it would be unflappable. Doesn't matter what's going on around, she's just kind of like, yep. Yeah, and she just deals. But she's been a total delight. She's also been rocking it out on our rural track. And she will be working as a family practice physician, Schuyler Hospital in Watkins Glen. So she's staying local. And at least you're not working for the evil empire, but congratulations.
Congratulations. Sorry, I lost my agenda. All right, Dr. Mazza.
Well, it's certainly nice to be here and see everyone in person and not through Zoom, that's for sure. Let me start by saying the gastroenterology department is alive and well and appears to have a long future in Elmira. Last summer, we endured our accreditation review process and have been approved for the next 10 years. Let me also say that of all our graduated fellows, we have a 100% pass rate with the gastroenterology board certification exam. The structure of our program remains strong with solid basic training for endoscopic procedures and clinic exposure at our home base in Elmira and continues to grow as we add more GI faculty. We have continued with excellent rotations in outlying facilities with exposure to motility courses and advanced endoscopic procedures. Some of our fellows have had elective rotations at the major inflammatory bowel disease centers in the country, and our current fellows are continuing with the same pattern. The reason the program has been successful is primarily because of the excellent input and contributions of our existing fellows. They've been very helpful to me in growing the program. Our 2 graduating fellows have been exceptionally involved with this growth. It's been my privilege and pleasure to have been involved with their training. The 2 fellows that are graduating, as most of you know, are Michael Kochek and Eddie Golikoff. I truly mean it has been their presence and involvement that has solidified our program. I hate to see them go. But wait! They may have graduated, but they're not going anywhere. Dr. Kochek. Dr. Kochek has elected to stay with us and has joined our faculty and will start in July. Those of you who have had the privilege of interacting with him understand that he is an astute clinician. I can't emphasize that enough. Honest, straightforward, hardworking, and to summarize, he is truly a doctor's doctor. So you can see, I'm very pleased to have him join our department. Dr. Golikoff has also elected to stay with us. But his return will be delayed by 1 year. Dr. Golikoff has a special interest and desire to practice advanced endoscopy and will continue with his studies with a 1-year fellowship in New York City for advanced endoscopic training, including endoscopic ultrasound and endoscopic retrograde cholangiopancreatography, or ERCP, which we need. With this training, he has also committed to returning to Elmira to bring his expertise with these advanced procedures to provide these services for our community. So again, I'm very pleased to have him join our department. You would think that after 3 years with me, they would have had enough of me. However, I'm very pleased to finish the next several years of my career with these two young, outstanding physicians.
Congratulations. Dr. Bushnell.
Okay, so I'm here today in place of Dr. Daskaloo, our program director, so I will be presenting for our graduates. Jeannie Budis has been a bright spot in our program for the past 4 years. She's shown incredible dedication to her patients, often being the last provider in the outpatient office to give everyone the attention she knows that they deserve. Jeannie is a psychiatrist I would be happy to send my family to, because her commitment to providing quality care exceeds the expectations of all of her patients. She has a therapeutic way of talking with patients that builds instant trust. I have enjoyed all of the time that I've been able to spend with Jeannie because of her fun, good-natured style. She's created collegiate and respectful relationships with staff in the inpatient and outpatient settings, evidence that she will make a wonderful leader in whatever field of psychiatry she chooses to pursue. After graduating, she's going to be practicing at St. Luke's Hospital in Allentown, PA. They are truly the lucky ones to have her as a member of their medical staff. Jennifer Rook is one of those residents who is always eager to do what is asked of her and to learn from every opportunity with which she is presented. While being a part of our family here at Arnott, she was also able to start her own family. Despite the struggles of being a new mother, she's always been a highly dedicated provider for patients in both the inpatient and outpatient settings. Her kind, grateful demeanor have made her a favorite of many staff. She has the ability to incorporate constructive feedback and constantly grow and improve to where she is now a very capable psychiatrist who provides the best possible care for all of her patients and for their families. She's not only providing therapy for her patients, she's a resident who nurses feel comfortable going to with any of their questions. After graduating, Jen will be providing much-needed telepsychiatry services to patients who may not otherwise get the opportunity to have mental health care through Talkateri Telemed. Rob Walker is the epitome of the laid-back psychiatrist. His calm demeanor helps put patients at ease and builds easy rapport. He's able to step in wherever help is needed and provide coverage for any service. Seeing him walk onto the unit in his Birkenstocks and khakis is sure to put a smile on the faces of the staff. I still remember the first time I worked with Rob as his attending in the emergency medicine setting. I was immediately impressed with his caring nature with an adolescent patient and the way he explored every psychosocial factor that could be contributing to her depression. He was enthusiastic and eager to help her. He's continued this trend throughout his training. His holistic approach embodies the tenets of osteopathic medicine, creating an effective and compassionate application of psychiatry. After graduating, Rob will be working at Woodhull Hospital in Brooklyn, where he will continue his trend of providing wonderful psychiatric care to the residents there.
Congratulations. Next, we have Dr. Heil.
So I'm presenting instead of Dr. Weisman today to honor my general surgery residents. It has been an honor and a privilege for myself and Dr. Anthony as plastic surgeons to participate in the education of the general surgery residents at ArnotHealth. We have loved having them join us in the operating room and eventually in our clinic. Now I turn my attention to the graduating chief surgery residents. Lucas Fee. I'm excited that you will be starting your vascular surgery fellowship following your path to what you are destined to become. I have loved working with you, watching you grow, and perfecting your skills in the operating room, even though you often threaten to use staples for closing incisions rather than using the refined suturing techniques we painstakingly pounded into your skill set. More importantly, I value your friendship. It has been wonderful sharing each other's lives, especially the updates and stories of your lovely wife and my busy adult children. Your wild mushrooms that you forage are a dear and much appreciated gift, and of course, a delicious addendum to many home-cooked meals. I love hearing about your cycling adventures and appreciate your reciprocal attention to my stories about my runner son, my car-obsessed son, and my creatively challenging daughter. I will miss you. I will miss having you around. Lucas, you need to go save the world one limb at a time. And Katie, my sister in the male-dominated world of surgery. The very fact that you just weren't having it completely made my heart fill with pride. We had very similar paths, which is amazing when you consider the time gap between my training and yours. In both professional and personal aspects, your friendship has helped to keep me moving forward. Your continued positivity, support, and humor in the face of the multiple challenges surrounding us has continued to keep me grounded. I will, of course, continue to keep that ongoing list of alleged resident and student abuse that you have accused me of, including wrapping my Christmas gifts in my office, driving my friend with cancer to chemo, and performing IT tasks for me because I am an internet idiot. You landed a job in your home state, Minnesota, one that you will love and excel at. For that alone, I applaud you. Being in the OR with Dr. Anthony and myself has never involved quizzing the residents. It's about technique and finesse and attention to detail. You and Lucas have excelled in all of this. I've grown as a teacher in teaching you and have learned from you in return. I love listening to you as you teach as well. Please bring this forward into your new career as an attending and pass this along to your future residents and students. Being privileged to work with residents is an awesome responsibility. I am honored to have worked so closely with you both. Good luck in both of your continued journeys as surgeons.
almost forgot what I was doing here. All right, and lastly, Dr. Reddy.
It's always good to go last. You guys are looking like you want to get up and get around, so I'll keep it quick, I promise. And I have a digital speech, which is really good. Yeah, well, when I was training, there was only one thing that was digital, so it's a little bit different right now. Anyways, sorry. Okay. And you know, these are really tough acts to follow. You know, they talked about COVID and then they, you know, and being the best day and all these things. It's actually not the best day for me. It's actually one of the worst days. I won't see most of these people ever again. And I spent 3 years trying to be friends with them. So it's actually not great, as it turns out. But at any rate, I'm just going to say 3 words about each resident, and then I'm going to try to give a brief explanation as why I have those 3 words. But before I start that, I do want anybody who's part of our faculty, who's part of teaching our residents, just to stand up so our graduating residents can give them a round of applause for everything that they've done. So you're out there, don't be shy. Dr. Sear, don't be shy, come on. Dr. Snellgrove, Dr. Badger. Yeah. Special thanks to the program coordinator, Angela. I know she had to come late. Okay. So I'm going to start off 3 words. Quiet, sweet, obedient. Those are 3 words that will never be described about Lakshmi. You know, I have a daughter and I have a son. My daughter's getting ready to graduate from college. And when I was younger, I was a terrible, terrible teenager. And my parents used to say, you know, I hope your kids are just like you. And I got really lucky that they're nothing like me and that they were really better. But God said, wait. You thought you were safe, but you were not. And then Lakshmi came along. So she did everything for me that my daughter couldn't. So the 3 things is argues, jeopardy, and family. I have never had anybody argue with me like this, ever, even when I'm right. And it's like, I know I'm right. It's in a book with really smart people. And in terms of jeopardy, I've never seen a more fierce competitor in Jeopardy ever. I fear for myself as the moderator for the most part. And I developed a gland disorder with sweating that I'm hoping goes away with this graduation. But and the 3rd word, family. You know, there's people in your life that you can be yourself around. You can say whatever you want to say, do whatever you want to do, and even if it's wrong, they don't hold it against you. And she's definitely one of those people for us. So she's going on to be a hospitalist somewhere in central Pennsylvania. I don't know where, but I hope she's happy there. All right, come on. Okay. Quiet, fastidious, and honest. Didn't have all the drama with Sarika like I had with Lakshmi, but definitely those 3 things. Showed up, came to work, did her work, was honest about her work, you know, which is actually something that people are really defensive about in medicine. You'll see a lot of hedge on honesty. We don't see a lot of that with Sarika. I think she's still relatively undecided on what she wants to do next year, I think her husband's trying to figure out what he wants to do next year, so I think between the two of them, they're going to find a home somewhere and figure out what they're going to do next year. So congratulations. Okay, who's next? These, they don't tell. They tell you you'll need glasses. They don't tell you how fast your heart rate's gonna, or your vision's gonna go. David, I didn't have 3 words for. I can't. It's 3 years, and I can't say 3 words about him. I can't tell if he's joking. I can't tell if he's serious. I just look and I smile, and sometimes he's joking, and sometimes he's serious, and then I just go to my office, and I just sit down and laugh most of the time. I can't tell. But, what I will say is that you can count on him. He gets his work done. He's a huge advocate for the patient. He's moving on for a fellowship in nephrology. We're going to miss him only because I've just never been this so uncertain of anybody. So okay. Laura, our chief resident and our resident of the year, and I think if we would have put her on for attending of the year, she might have won. And I think if we put her on in another department, she might have won. But the 3 words I have for Laura is war-torn Poland. She wants to cut everyone. She wants to do something to everybody. She's moving on to cardiology. She's going down to be, I guess, a hipster doofus somewhere down in Brooklyn. I'm not really sure. But we had somebody come in not that long ago that needed to have a preoperative evaluation for knee surgery, and they actually were having cardiac symptoms, and I swear she was going to go through the knee, into the heart, do a cardiac cath, come back down, and give him a partial knee replacement in one procedure. I've just never seen, she is 3 generations. She should have been born, she could have been in the war field just doing one procedure after the next, because that's what she's motivated by. But fortunately, she spent a lot of time making my life a lot easier this year. So I do want to thank her. I'm going to miss her. And hopefully, if somebody's here from Arnott, they can try to recruit her to stay when she's all done. Give her lots of money or something. I don't know. I think she could actually have taken, she could have taken my job now, probably. I don't know. It's not great. All right. Huram Khalid, kind, thoughtful, and truthful. Those are the 3 things I thought about for him. He shows up to work every day. He's kind of like, I don't know if anybody follows NBA basketball, kind of like a Tim Duncan. You know what you're getting out of him. Shows up, no advertisements. You know who he is. No advertisements, doesn't get involved in endorsements, comes in, shows up, does his job, goes home. That's what was important to him, patient care, making sure he got good enough at his trade to be able to take this everywhere. So I think he's moving to Texas, but I'm not sure what he's doing quite yet. But we're going to miss him. I've been offering him jobs, but he keeps turning us down, so good luck, I guess. All right, who's next? Sang. So, smart, disciplined, and laugh. I can't not laugh when Sang laughs. Somebody's coding, and he'll laugh. And I'll laugh. And it's not the right time to laugh. It's definitely not the right time to laugh. But I just can't help it. I can't help it. But as a chief resident, he did keep everybody on track. He has a level of discipline and authority that I was never able to capture. He works hard. He's bright. He's moving on to a cardiology fellowship. He's going to he's going to be really, really missed because he was a backbone that I haven't been able to develop yet. So he was able to do that for me. But keep on laughing, man, because I got to tell you, it is super, super contagious. All right. Congratulations. Alphabetically, the next one is Ahmed Noor. He did not show up tonight. He will be graduating. And I also don't know what he'll be doing next. Bryce. Kind, sincere, and hardworking. You know, there's schedule holes that show up all the time. Anybody who makes a schedule knows that. And, you know, we'll be looking for solutions. And Bryce's solution is, I can do that shift. I can do it. I'll do it, Dr. Reddy. No, Bryce, you don't have to do every shift. We can put other people in. He's like, I don't mind. I'll do it. He is in a forever pattern of trying to make everybody happy and gets pretty darn close. I hope for his own sanity he stops trying to do that because it's really an impossible task. His sincerity is it's impressive and it's something that I aspire to. Everything he does is an open heart and innocence, and that's a really rare thing today anymore. So I'm going to miss his innocence. I'm going to miss him plugging the holes in the schedule all the time, and I'm certainly going to miss his kindness. All right, Red, come on up. All right, Dimple. Happy, genuine, and pretty sarcastic. You know, I had to be really careful because her sarcasm would take me off guard sometimes. And I would say something stupid. And she's like, "Are you serious? Do you mean that?" I'm like, "No, I don't mean that." She's like, "No, I know you were kidding." I didn't know if she was joking or I was on my way to human resources. I really, really had a challenge trying to figure this out. I am really happy, though. She was a constant, a positive, really positive influence. I think she was a really good role model where we never saw her get involved in any of the drama of the residency. She just came to work, did her work, kept all of her personal feelings aside, treated everybody as peers, and is really, really, it's admirable to be able to do that. It's really easy to bring emotion into something that, you know, when you're taking care of people. But at any rate, I do look up to her ability to be able to keep professional the entire time, and I admire her for making me feel like I'm stupid more than a little bit, so. Oh yeah, she's going to a hospice and a palliative care fellowship. Okay, 3 words for Brittany. I'm fat. Brittany has spent more than 3 years feeding all of us. All the time. We're all heavier than we were before Brittany came. Not a single one of us is any lighter before Brittany came. But joking aside, for the amount of effort she puts into that, I don't know how she has the free time. We're really, really, really lucky to have her join our outpatient practice. She's, you know, the only one of us that's sticking around. This community will embrace her as well as they've embraced me or anybody else, or even more so. There hasn't been anybody who's been more true to herself and more true to trying to take care of people and work just to be better each and every single day. So we're really lucky to have her. I'm really happy she's staying, and she'll continue on staying as my friend and hopefully not cook as much. All right, I'm done.
Congratulations. I'm going to have Dr. Edwards come up and give an honorable mention to our research fellows.
Thank you, Mike. This is my first live event in 2 years. I'm looking for the unmute button. But, we've, for the past 3 years, have had a program where we bring in research fellows. We've actually had several different names for them: research assistants, research coordinators, research fellows. They are graduated physicians who are in the process of not yet beginning their residency training, who come here for a year and devote themselves to helping us improve our scholarly activity, help with research projects. They're embedded in the teams and the various specialties of their interest as they prepare to become residents themselves, which I'm very happy to say they all are. And I don't know how many of them are here today, and in the interest of time, let me just give their names, and we can give them a round of applause at the end. Okay, there are 7 this year. Our lead coordinator, Dr. Uma Yoganathan, I still don't pronounce it correctly, who's going to be joining our surgery residency, along with Dr. Sajpreet Kaur, also becoming a surgeon, Dr. Ayman Azrar, who's going to be a family physician, training here with us, Dr. Darren Wong, also becoming a family physician in a different program, Dr. Mohammed Mana is going to be joining our internal medicine program. He's going to be a fine one too. And Dr. Ted Kuzov, who is joining the family medicine program with Dr. Baxter. And he's going to be fantastic. There was Dr. Rabi Shahzad, who was with us until about 2 months ago when he left to join a psychiatry residency down in New York City. They've all done a fantastic job. So they spend a year working, helping, devoting themselves to improving our scholarly activity here. So it's a fine program, and it's going to continue growing. And let me also take a moment just to thank everybody for the wonderful send-off. It's much appreciated, and I've certainly appreciated working here for the past nearly a decade now. It's been wonderful. Best time of my life. I'll have fond memories. So, for the coordinators, a round of applause. Thank you.
And that seems like the right place to stop. Thank you all for joining us. Thank you for being here for your graduates. Graduates, congratulations. It's been a long road. You've earned it.